Hello. Um, this week is the Mental Health Awareness Week. So we're hearing about lots of different conditions that people experience. And as a health professional and also as a parent, um, I'd like to bring to your attention of being in parenthood, in particular for women and women who are pregnant. And in general, when we're pregnant, when we say when we're pregnant, when women are pregnant, people expect everyone to be happy, joyful, and in particular when they've given birth. And in that situation, the new mother can feel a lot of stress, anxiety, and not being able to express how they're feeling. And if you feel like that as new mothers, and society expects all mothers to be happy if you've given a birth to a healthy baby. But most of the time, around 85% of the time, women can experience baby blues, and that's common. And it normally disappears after, say, 2 to 4 weeks or so. And as I say, 85% of the women will recover, and it's manageable. But around 15 to 20% of women will experience stress, anxiety, and sort of postnatal baby blues. And it sort of presents itself around between 6 and 12 weeks. Now, you don't need to suffer alone because there are services that's available across England, Scotland, and Wales, and it's called talking therapies. And you'll get support from practitioners across the different ranges depending on your needs, on the principles of CBT and with CBT as well. So if you're experiencing those baby blues and you're not able to share that with people, remember you're not alone. If you're experiencing unhappiness, irritability, tearfulness, sadness, lack of sleep, these things are happening as a result of the hormonal changes that you've gone through in the first 9 months in preparation for birth. And then again, your body prepares from the birth onwards to feed the baby and all the other changes that goes on. So they say the first 12 months in terms of up to 2 years, you can experience these baby blues. And sometimes it goes on for further. But what I'm trying to highlight to you here, all new mums and parents who are looking after new mums, is that you're able to get help because this is a condition that you don't have to live with. You can have support with if you speak to your GP, if you speak to your health visitor, midwife, or your practice nurse. In addition to that, you can also go online for help and ask for help. And I can certainly speak for the United Kingdom and the English system is that in most of the services, postnatal depression will be expedited. And what that means is that when you refer into the service, you will be assessed. And then when you share those in the assessment, that how you're thinking in terms of your thoughts, your worries, you're expecting the worst to happen. Sometimes you'll have hopeless thoughts. Am I a good mum? Am I being a good wife? Everyone wants me to be happy, but I feel sad. And there will be lots of jumping to conclusions and asking a lot of questions and have fear. In addition to that, you may also find that you're avoiding people. And as new mums, you will inevitably stop doing a lot of the things that you used to enjoy, going out, socializing, and it will be all around the baby in itself. So there will be a sense of feelings of sadness, guilt, anger, irritability, and feeling worthless at times. And these are the symptoms that you're not getting alone. It's happening to everyone who's going through that process, but some more than others. And again, as I say, 15 to 20% will experience a lot more symptoms than most new mums in that situation. So just think about it. If you're unable to relax, you feel agitated, you're slowing down, you have sleep disturbance, you're lacking in energy. how that's going to make your situation even more worse. So, in these situations, you can ask for help. And the other organization that you can go to is, if you go on to the website, Google, and search pandas, PANDAS .org, .uk. So that's pre and postnatal advice service, and also the family health service. So if you go to those websites, they will be able to guide you as well. But remember, you don't need to struggle with postnatal depression. It's okay to feel unhappy, sad, irritable, because it's not you, it's the hormones, it's the changes and the physical and the social changes that's going on in your life and everything else that's impacting on you. And just think that if you were to lock somebody away for the next 12 months, 24 months, and they lost a lot of those facilities that they used to utilize, and all those changes occur, and there's nothing to be ashamed of as a woman to say that I need help. So, you know, I know that it works, talking therapy, CBT. I've worked with women who have come along and shared those thoughts and feelings and their behaviors. And it's a matter of weeks, it's a matter of weeks that if you work with a clinician for up to between 6 and 12 weeks, they can work with you to get you on the path to recovery. And you can also look at options for medications as well. So don't be alone, don't suffer alone, and get help. And all the best. My name is Mal Mahibullah Chowdhury, and I'm doing my bit for Mental Health Awareness Week for new mums and parents. Take care, and all the best to you.